recording. Okay, so everybody's here. So welcome to week 3. Where have 2 weeks already gone? Not quite sure. How's everybody doing with keeping up with all your classes and organizing due dates and exam dates and quiz dates and assignments? How's everybody doing with all that?
It's a chore, but we doing it.
Okay. Does anybody have any questions from last week? Okay. So the one thing I would like to do is start. So the way class will work today, we'll start out taking quiz 2. It's a 15-minute time limit. I have students with accommodations that require extra time, so it might be a little bit longer. So we'll start by taking the quiz, then we'll come back and we'll review the quiz, do some lecturing, do some teaching from the quiz. And then I'm going to review the rest of week 3 content. Okay, and then I'm going to break you up into groups, and we're going to do the case study that I presented to you in the announcement this weekend. So I'll break you up into 3 groups, and you'll go into a breakout room for a little bit, talk about the question you're assigned in the case study, and then we'll come back and we'll talk about it. And this case study has to do with the content we're covering if you already opened it. So make sure you have your computer open, ready for the case study. Also, when we do after the quiz, make sure you have your notes attachment that I sent this weekend open, so you can take notes, or on your wherever you take notes. There is a attachment that's opened up that is sent to you, meant to take notes on the different concepts. And I'll pull up the PowerPoint and we'll go through it by the PowerPoint. Okay, but I need you to take good notes. Okay. What else? I sent out groups yesterday for your group project that's in week 7. I did my best to try and keep as many students together in campuses, but it's not an even split. I mean, I did my best. So if you didn't end up with a lot of people in your campuses, I'm sorry. I did my best trying to organize it, but the numbers don't always come out equal to 4 people from the same campus or 8 people from the same campus that I can break up. So you have your group assignment. I would somebody take the lead and reach out to the group early. Hi, we're Alpha Group doing this infectious disease. Let's split up what each of us wants to do. The directions I think are pretty clear. This is due the Sunday of week 7. I know it's only week 3, but if you want to get working on it, please feel free to get working on it. If you have any questions, let me know. This is exam 1 review week, since at this time next week you'll be taking exam 1. I know Professor Ford had her exam 1 review this morning, and there were no students that showed up. So I haven't seen it. I'll have to check with her, but if no students don't show up to a review, then the instructor's not required to do the review. So I don't know if she did a recording. She really didn't need to, but if she did, and I just haven't had time to check with her, the only thing I know is nobody showed up. So there might not be a recording attached with that review.
Do you know what she did it this morning?
Pardon me?
Do you know what time she did the Zoom?
Yeah, it's on your master schedule. It was at 8 a.m. Eastern time.
Oh, okay, because we had class at 9. I didn't know if maybe that interfered with it, but we had our PEDS class. Most of us did this morning.
Okay, at 9 though, right? Not 8.
Correct.
Right. Okay. So
But
there's 2.
their time is like your time. So when she was doing her review, I was in class
At 8 a.m. Eastern.
Yeah, we were in class at 8.
Our teaching piece is an hour ahead of us too.
Okay. Okay. So there's 2 more reviews. I have one Friday after my I forget what time I think it's 6 p.m. Eastern.
Yeah.
I have to,
It's
is that
6.
6, Charmaine, 6
Yes.
Eastern time. And then Professor Kershaw has hers on Sunday evening, I think at 6 p.m. Eastern time as well. So hopefully we'll get some students at those and we can do some recordings so that everybody can prepare. Okay. What else was I gonna mention? Reviews. I'll send out an announcement this weekend just with some guidelines for the exam. Nothing new. There is nothing new, but I would highly suggest that you do if you already haven't, do your exam soft practice test between now and next Monday. That's the practice test that doesn't take very long and it really just ensures your compatibility with your equipment and Exemplify so that we don't run into issues when we get to the exam next Monday. Okay, does everybody know what I'm talking about? I sent an announcement out about that with the password, Fortis01. So please do your exam soft practice test before next Monday. Okay.
Miss Marvin,
Questions? Yeah.
case or just the uppercase F. You said
Par-
Ford is 001, the password.
Yeah, it's in your announcement. It's in the
Oh,
announcement. Fortis01. It's just a
oh,
generic password for everybody. All right. What else? Do you guys have any other exams this week? Do you have a PEDS exam this week?
no, next week we have an exam in med surge too tomorrow, but no, next week's peds too.
Yeah.
That's what I meant, next week. So next week you have a PEDS exam as well as a community exam. And if I remember correctly from last term, this exam 1 has has 2 exams in 1 week with PEDS and community. But going forward for exam 2 and exam 3, they're not in the same week. But for this, so are most of you taking your PEDS exam right before? Are you both taking both of them on Monday? Okay.
Yes.
Okay.
Yes.
All right. So that's something that can't be changed. So really going to have to divvy up your time and make sure you get prepared for both exams. This is the exam that when I meet with students, the most common when we talk about if they didn't do well on exam 1, this is the exam that I get the comment from students that said, we had 2 exams in the same week and I was focused on PEDS and didn't spend enough time on community. So I'm just throwing that out there. So I would really encourage you to, if you need some help prioritizing or preparing, that's the other thing about reviews. If I will get you Professor because you're a Monday class, Monday exam day. I will get you Professor Kershaw's recording Sunday evening. I will get it to you Sunday evening. She knows to send it out to the other 2 professors right after she's done. She has to wait for it to convert, but I will not go to bed Sunday night until I have that recording and I can send it off to this group because you're a Monday class. Okay, so you will have that one Sunday night, and then you will have mine Friday night. Okay, and then my other offer to you is after you've done your due diligence, okay, and preparing for the exam, either attending a live review, watching the recordings, if next Monday morning you're still having issues with some of the concepts, please reach out to me and we can jump on Zoom and review any of those last concepts that you don't feel like you have a handle on. Okay, so jot that down for Monday morning. Alrighty? Okay. Questions? All right. Let's all jump into exam 2. It should be open for you. It opened at the top of the class at 3 o'clock. The passcode is the same as last week, Marvel, Marvel. Go ahead and start that. Again, it's 15 minutes. For others, for most, it's 15 minutes. For a few others, it may be longer. Please take your time. Make sure you hit submit when you're done. You have to stay on camera while you're taking it. If you get done early, don't come off Zoom. If you need to go run and get something or maybe shut your camera off for a couple of minutes, that's fine. So it is 3:11 or 3:10. So why don't we 20 minutes? Why don't we all plan? I mean, I'll stay here. I'm going to mute myself and take my camera off while you take it, but I am here if you have any questions to put in the chat. So everybody plan on being back no later than 3:30.
Professor Marvel, did you say Marvel 01?
Nope, just Marvel.
Okay.
It's Fortis 01, Charmene, for
Gotcha.
the exam soft.
Gotcha.
Plain old Marvel, capital Marvel. So I'm going to go ahead and mute everybody that's not muted, mute myself. If you have any questions, just, I don't need to know when you're done. If you have any questions, throw them in the chat and I'll answer them as we go.
Miss Marvel, where's
Yeah.
the quiz? Still saying key graded assignment on the week. What is this on the week 3 for me? Make sure I'm in the right class. Yeah.
Yeah, I don't think so. I think you're maybe in the wrong class.
Oh,
Oh, well,
hold
yeah,
on.
we are. No, we're in week 3. We're in week 3.
Hold on, never mind.
Yeah, it's really in week 3.
Yeah, it's in week 3.
Yep.
Yeah.
Okay. All right,
Okay.
I'm going to mute everybody and I'll see you in about 20 minutes.
Mm-mm.
How's everybody? Everybody done? Anybody still working on this? All right, if ever, pardon me, if everybody could come back on camera, that'd be great. Sounds like nobody else is working on it. How'd you do? How'd everybody do? Any feedback or input before we get started in reviewing it?
Whoops.
Yep.
Pardon me?
I just said yep.
So obviously this week we're covering, Mariah, you there? Cindy, you there? This week we're covering some of our more vulnerable populations, right? The migrant farm worker, rural populations in general, homelessness, and people who live, populations that live in poverty. And those questions gave you a variety of each one. Let me go ahead and share my screen. Mariah, are you there?
Go to my notes because that ain't what.
Professor,
Yes,
I was gonna, can I get off of Zoom on my phone and log on
of
my
course.
laptop?
Of course,
Okay.
Casey. Of course. Just waiting for Mariah to come back. We can get started. Okay, Casey's coming. Okay, let me share my screen and we will review the quiz. And jump in to answer, to provide input. Have any questions, please feel free to jump in. Okay, can everybody see my screen?
Yes.
Okay, question number one is about a rural community. About the rural community. What should the home health nurse anticipate about clients in a very rural community? What did you learn about reading through your Canvas reading? And by the way, there were no book readings this week. It was all Canvas reading in your module. What did you learn about what to expect with regards to clients who live in a rural population?
More likely to have complex chronic illnesses,
Yeah, why is that, Brian?
lack of access to, or lack of ready access to quality health care.
Okay. So play that forward. Lack of access, lack of transportation, just a whole lot of barriers, right? In
Lack
the
of-
rural population. So when we see them, they're going to be at much more at the advanced stages of a condition or an illness, right?
Mhm.
And we'll talk more about rural more in depth, but so yeah, the answer is A, more likely to have complex chronic illnesses. What about B? Why is B the wrong answer?
B, most of them have employer, because most of them will not have employee provided insurance, according to our reading.
Exactly. There aren't a whole lot of jobs in the rural communities that provide employer health insurance. So, again, another reason why they may not be seeking care, at least primary care. Right? What about C? Why is C wrong?
Because it's likely less, it's more.
Is, yeah, more likely.
Right?
Yeah, they are more likely.
Right. And we'll talk about this a little bit later, but what's the most common environmental chemical exposure to rural communities?
Pesticide.
Pesticides.
Pesticides. A lot of these rural communities are agricultural communities as well. Okay, what about why is D wrong?
Because they have less less access to the physicians.
Right. In the rural communities, there's not a whole lot of choices for healthcare. Right? You might have family physician that covers a couple of counties. Right? You might even have a nurse practitioner that covers several counties. You certainly don't have specialists, high risk OB, oncology, neurologists, very limited, if any, in the rural communities. People have to travel to the bigger cities to get the more specialized care. Okay. Question number 2. Another rural question. So you're the nurse, you're the rural community nurse, and you're trying to develop a primary prevention program for members of the rural community. Okay, let's review. What's primary?
To prevent from happening.
Okay. What's secondary?
Screening.
Screening, yes.
What's tertiary?
Making sure they
Teaching
have,
or educating.
don't get worse.
Go ahead. Somebody else was jumping in. Go ahead.
Treatment.
Treatment, management, treatment. Yes. All right. So you're a nurse developing a primary prevention program for members of the rural community. Which intervention are you going to choose?
I said educate families on diabetes related foot care, but
What's wrong with that? What's wrong with that? Why is that not primary?
Because it's
already,
treatment.
they already have it.
Tertiary.
Yeah, they already have something, Charmaine, right? They already have diabetes,
Yeah.
right? And remember, I explained this last week, and I don't know if this is what you did, Charmaine, but do not simply assume that education is in the primary level,
Yeah.
right? We're educating, remember we talked about this last week, we're educating at every level.
Right.
In the primary, we're educating to prevent. In secondary, we've identified risk. So we're educating on how to reverse that process, right? Or reduce risk, educating on how to reduce risk. And then in tertiary, we're educating on how to how to manage whatever you have, the effects of an injury, the side effects of a chronic disease. They already have to have something. So we're still educating. So I don't know if education threw you off, Charmaine. I have no idea.
It
Okay. Does that make sense now though? But
does.
Okay.
It does.
All right. So what's the right answer?
Provide information on excessive sun exposure.
Right. Right.
Mhm.
Why is that primary?
Because that's something that you could prevent. So it would just tell people about sunscreening and hats. Just stand out of the sun.
Right.
You're preventing a problem before it happens.
Exactly, Victoria. Okay, what's A? primary, secondary, tertiary.
It'll be
Secondary.
screening.
So it's secondary.
Mhm.
We already explained why Charmaine was wrong with C. What about D? What's D?
Secondary.
Secondary.
Right,
It's another
Screening.
screen.
right. Right. Good. Okay, migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, and cough. Which nursing intervention is appropriate? Before we answer this, from your readings, what could this be the possibility of?
Tuberculosis.
Mm.
Or
Pesticide exposure from working out in the field because
Right.
it's a worker.
So think it. Let's look at the question. Let's look at all the important information in the question that you. Let's assume this is an exam test, a question, and you're using your highlighter, right? Because I know everybody's going to use their highlighter, right? What would we highlight in this question? Well, it's a migrant farm worker, right? So we have to consider the population. Couple of complaints: bilateral irritation, throat irritation, cough. So they have certain symptoms. So thinking about the migrant farm worker and these particular symptoms, we have to think about, okay, what might the migrant farm worker be exposed to?
chemicals.
Chemicals,
Pesticides.
right? And what's the most, well, we already talked about, what's the most common exposure? Pesticides,
Pesticides.
right?
I got it right.
Why is A wrong?
Remember.
It's not symptoms of conjunctivitis.
Exactly. Maybe the first one is irritation. The
Yeah,
throat irritation and cough have nothing to do with conjunctivitis, right?
right.
Why is C wrong? What do
Because we don't know what it is, so that medication wouldn't be involved.
Well, not only do we not know what it is,
But nurses don't diagnose.
thank you. That's exactly right. And everybody here at Pretoria said, we don't diagnose and treat. Okay, so we would not be doing C. What about D? Why is D wrong?
It's a screening, the one.
Hang on, I'm just looking at a message from a.
Screening.
Go ahead. Tell me, I'm sorry. Tell me again why D is wrong.
Complete.
Because of the bilateral eye irritation.
Exactly.
Because they already got it, so you don't
No.
need to do a screening.
Right. We're not sure that these symptoms are not there. These aren't
Concurrent to TB.
yeah, we're not, this doesn't signify the next question. There are more specific signs and symptoms of TB. These are not them. These are signs and symptoms of a pesticide exposure. Okay? Correct answer is B. Okay, question 4. During a home visit, the nurse notes that the migrant farm worker is living in a small house with several other families, which in nursing assessment is a priority. Okay, what's important? There's a lot of good cues in this question. What are they?
The migrant farm worker family.
Migrant farm worker family is your population.
Living in a small house with
Other families.
Mhm.
And which assessment is a priority? So you get 3 cues. You got your population, what the circumstances are, small house, living in a small house, several other families, and it's asking for a priority. So what might this be indicative of? Maybe.
Tuberculosis.
Right. In your readings about migrant farm workers, what does it tell you?
My computer.
It tells you that
Tuberculosis.
That tuberculosis is a high risk with migrant farm workers. We're not saying this is an outbreak of tuberculosis, but what we gather from this question is that migrant farm workers are at higher risk for TB when one of the issues is when they're living in small quarters with lots of other people. Right? So the priority would be to do a TB screening questionnaire. Not to say that's what it is, but they've got a few things going on that make them at risk. Okay? We don't have any information that this is a history of a GI reflux disease. Ability, let's see, what's priority? Ability to travel into town for healthcare services. No, that's not a priority. Access to and consumption of nutrient-dense foods. That's not a priority. It's a priority to do some kind of a TB screening. Make sense?
Yes.
Okay. Okay, so this is a poverty question. Which statement reflects the impact of income on health outcomes? Just think about it. Think about in general, before we even look. Let's assume you have an individual, family, community that lives high, community that has a high poverty rate, individual who lives in poverty, families that live in poverty. Without even looking at the answers, what are the risks? What are some risks?
They have a risk of higher incidence of chronic illnesses.
Mhm.
And
They don't have access to like getting to the doctors for wellness visits and
Maybe
things
there's an
like
issue with transport. Think about poverty in general, all the limitations. Maybe there are barriers. Maybe there's issues with transportation. Maybe there's issues with making appointments. Maybe there's issues with language barriers, right?
yeah.
But Brian's right. Right? The correct answer is low income increases the risk of chronic illnesses for things that Charmaine just mentioned, and again, kind of similar to the rural population. They're just not focused on their primary health. Okay, why is A wrong?
Because Medicaid is not guaranteed.
Exactly. Exactly. What about B?
High income reduces the tendency. It would be low income.
Low income.
Right. And then D is just wrong. High income does not improve health outcomes. It does. Maybe better access to care, better access to quality care, living in an area that has more specialists. Because we know that rural populations tend to have higher poverty rates, right? What should the nurse anticipate for a family living just above the federally defined poverty line?
Reduce vulnerability.
Well, go ahead.
Was one of them reduce vulnerability due to employer provided insurance?
That's not the correct answer. What's the correct answer?
Increase for letter
increased
A.
ability due to fewer community resources.
Right. It says, the question says they're living above the poverty line. Just above, doesn't matter. Once you're qualified as to living above the poverty line, that's going to give you less access to community resources, right? When you have less access to community resources, you have increased vulnerability. Right?
Yes.
I'm sorry, I just need to respond to a student who's having trouble getting back into the class.
I'm back, Miss Marble.
Oh,
It came back. I was like, what in the world? But I was trying
okay,
to log
good.
back on my
Okay,
phone.
awesome. Okay, awesome. Okay, awesome. Thank you. Thank you. Okay. Question number 7. This is about another poverty question. Which client is at the highest risk for adverse health outcomes related to poverty? You're using your highlighter. This is an exam question. What are you going to highlight?
Highest risk.
Highest risk. It's asking specifically. Okay. Then the second part, this is an exam question. You're going to use your underliner. What are you going to cross out that you know is not a right answer?
Highest risk.
Maybe the
The
19-year-old male with a history of asthma.
68-year-old female with type 2 diabetes.
Okay.
And what a 4-year-old male working.
Does a 19-year-old male with history of asthma has anything to do with poverty?
No.
Not
No.
necessarily. Does a 68-year-old female with type 2 diabetes have anything to do with poverty? Probably not. What about D? I don't know, maybe a 44-year-old male working on a farm? Maybe, because we know that migrant farm workers, rural populations tend to have a higher risk of poverty, right?
Mhm.
Okay, but can we cross out B and C? All right, so here's a perfect example of an exam question. Right? If I were you, and this is the way I was attacking my questions on the exam, I would go in, take my highlighter, highlight what Shawnee said, highest risk. So we know it's a priority question, right? Highest risk, highest. Then I'd go underline and say, well, really the B and C don't necessarily have anything to do with poverty, right? So now you go back and read the question the second time. You've got a highlighted word and you've got 2 available answers left. So now you get a 15-month-old without a medical history, a 44-year-old male working on a farm. But who is at higher risk?
15-month-old.
The one that can't do for herself, the baby.
The
Right.
baby.
And why is that baby at higher risk than the 44-year-old on working on a farm?
No medical history.
Exactly. Exactly. That's a problem. We don't know what immunizations they have. We don't know what their medical history is. This is a very high risk client, the baby, for now, because we don't have anything. Okay, so so did you see how I attacked that question?
Mhm.
I made it really easy. Highlight an important word, cross out 2 answers. So I know I'm getting a bit off here, but doing part of my review, actually, exam review this upcoming Friday. I guess I'm giving you a sneak peek. But does that help? Talking about a question that way?
Yes.
You can really simplify questions. There is a good tutorial that I'm going to try and find for my review Friday. It comes from my Elsevier instructor resources. There's actually a lot of good tutorials when it comes to exam taking. And one of the tutorials, I'm going to dig that up, is how to break down questions. And that's where I learned how to attack a question like that. Not like that, but just in general, of highlighting important words, cues, phrases, eliminating answers. So I'm going to try and dig that up. And I might even dig it up and send as an announcement attachment so everybody can see it. Okay. Which would the school nurse expect from an impoverished adolescent? Okay, so what are the key words in this question? What do we have? Who's our client?
Impoverished
An
and adolescent.
two cues: impoverished and definitely adolescent. That makes a big difference, right? Because different age groups for the school nurse have different outcomes, have different thinking, have different ways we intervene with them. Okay, what did you read? What did you read about this, about adolescents? What is one of their biggest risks?
Increase of dropping out of school.
Dropping out of school.
Increase of
Dropping out of school. Okay. Let's say you went through and highlighted impoverished adolescent. What answers can you automatically cross out?
Improved attendance.
Wouldn't you be able to cross out A because
it's going to be increased risk.
increased risk of unintended pregnancy? Cross out A. If we have an impoverished adult, are they going to be likely to have excellent coping mechanisms or pretty challenged coping mechanisms?
Challenged.
Challenged. So we can cross that answer out. Right? Do we think an impoverished adolescent? Well, D, I don't know. You could, well, maybe if it's an impoverished adolescent, they may take advantage of extra activities. I don't know. So I'm not ready to throw that. I'm not ready to throw that one out yet. But I can certainly throw out B and C, right? But from our readings, we can see that one of the greatest risks is dropping out of school. Okay. Okay, it's a homelessness question. Which client is at the highest risk for homelessness? What would we highlight in this question? What's important?
Highest risk.
Highest risk.
And what's who's the population?
Homelessness.
Okay, so now we're talking about risk for the homeless. Okay, what's the right answer here?
Veteran
B.
post-traumatic stress disorder.
Veterans post-traumatic stress
alone.
disorder. Living alone.
Okay. Absolutely, that is the highest. Now, let's look at the other answers. Everyone here is at risk. Everyone. An adolescent with substance addiction is at risk. Adults with schizophrenia are at risk. Older child with history of suicidal ideations at risk. But look back at the answer. The adolescent with a substance addiction issue lives with a supportive family. That's great. Okay, the adult living with schizophrenia lives in a group home. That's great. Older child with history of suicidal ideations, maybe you make the assumption that because they're older, they're working through that. But a veteran with PTSD living alone is certainly the highest risk, right?
Yes.
Because there's nobody watching over, there's nobody doing check-ins, or there's nobody living with this veteran. I hope everybody got that one right. Did anybody get that one wrong?
Nope.
This is also a good example. Another thing I talk about with exam questions, is let's say you missed the word highest risk in this question. You read through it quickly and it said, which client is at risk for homelessness? Didn't say, you missed the word highest. Let's say you go start reviewing these answers and you think, well, any one of these could be correct. It's not a select all that apply, right? What do you need to do?
What?
What do you need to do?
Use the highlighter to figure out.
Okay, but let's say you didn't use the highlighter. And you read it quickly and you read which client is at risk for homelessness. You come to the answers and you say, God, that's kind of hard. All of them could be correct. What should you do?
Read
Go-
again.
Yes,
narrowing
go
down.
back and reread the question to see what word you missed. Because if you can't select more than one answer, you miss something. Okay? I'm just trying to help you out here. A little bit of content, a little bit of exam strategy. Okay? Okay, last question. So another homeless question. You're working in an outreach clinic at a homeless shelter. Which client should be prioritized? Okay, so you think about it. Think about the environment. You're in a homeless shelter. So you're working with homeless clients. You're asking to be prioritized. This is how you have to think forward. So in a homeless shelter, what might homeless people living in the shelter be more at risk for?
Chronic illness.
Chronic illnesses. Or catch
Tuberculosis.
Okay,
something.
all right, yep, they're going to be at risk for chronic illnesses. Okay, but that's not one of the answers. Okay,
It's
so
something-
The tuberculosis, I think.
Tuberculosis, like,
exactly, living in crowded shelters with compromised people could be at risk for TB. What are some symptoms of, remember the question's asking prioritize. Again, this is another question that you could look at and say, all these answers could be correct, but what did I miss in the question? There must be something in the question that's going to direct me to one particular answer. You missed the word prioritized.
so it would be night sweats and unexplained weight loss.
Because those are symptoms of maybe what?
Tuberculosis.
TB, which homeless shelters have an increased risk. Correct?
Yes.
Because of the close quarters and all the maybe unsanitary things that are going on, or living in close quarters, or unsanitary practices, chronic illnesses. It's not that worsening foot ulcer and purulent drainage, it's not that doesn't have to be taken care of. It does. It's not that we shouldn't be looking at frequent urination with constant hunger and thirst. Yeah, that's an issue. That needs to be looked at. Difficulty sleeping due to panic attacks. Yes, that has to be looked at. Those are all issues. But if we think forward on environment, homeless shelter, people more at risk that live in homeless shelters for communicable infectious diseases, we have to prioritize who we're going to care for first. So complaints of night sweats and unexplained weight loss should cause us to take a look at that client being prioritized. Does that help going through the quiz like that?
Yes.
Yes.
I haven't looked to see specifically what each person missed. So that's why I asked a general question. You know what you missed. Hopefully you have a better understanding of what you missed and why you missed it. Any questions? All right. I am going to jump to your weekly Canvas reading and start there and support the rest of our content from here. So what'd you learn about migrant workers? What are migrant workers? What kind of workers are they? They seasonal, move around a lot. What'd you learn?
They seasonal.
Okay. They move around a lot. So what issues does that, what issues Or what issues come from that?
Housing conditions, not favorable to them.
Okay.
Being, poor quality, crowded places.
Okay.
That contribute to health problems.
Okay.
And exposure to
There
levels
are
of lead and, common sicknesses like gastritis and bacterial
Okay.
infection.
there
What
are
else
high
did
risk
you
of
learn about? What else did you learn about migrants? The specific question I'm asking you, why is it, what risks does it present when they're seasonal? They're moving around. Maybe there's a
sexual
language barrier.
Yeah, there's a language
there are
barrier.
high risk of sexual harassment.
Okay. Okay. Much
Uh,
more. Migrant workers, much more at risk for domestic violence, sexual
Yeah.
abuse, sexual harassment. What I'm trying to get, the answer I'm trying to get at is because they're seasonal and moving around a lot and don't have health insurance, most likely don't have health insurance, it's hard to track them. Right? So let's say they show up at a migrant clinic and they're diagnosed with hypertension. They're diagnosed with something. Okay. And they go on a treatment plan. What if they're moving around in the next couple of months? Do you think their record follows them around?
no,
Of course it doesn't. So there's gaps in the system. So let's say they're non-English speaking, they're not feeling well, they go to a migrant clinic and they can't really articulate what's going on. So language barriers also an issue. If language is an issue, comprehension is an issue, they're going to have a hard time understanding what services are available to them. And there are services available to them. There's migrant outreach clinics throughout the country. Not everywhere. But we as rural community nurses need to be able to make sure our migrant farm workers who are just here temporarily understand what services are available to them. Right? Typically with migrants, they don't have private vehicles. Right? We got to think about the kids working in the fields as well. Think about all the risks of the kids. Heat-related exposures. Maybe maybe their education has been interrupted. They're not in school. They're not getting their maybe regular immunizations. Lots of risks for kids on the farms. We do know that migrant farm workers are the backbone, right? They're backbone, one of the backbones to our society. We wouldn't be getting a lot of food in our tables if it wasn't for migrant farm workers, right? We talked about housing. They often lack adequate housing or it's substandard, sanitation issues, lead issues, structural issues, mold issues, pesticide exposure issues. We already talked about common TB, gastroenteritis, other infectious hepatitis, infectious communicable diseases. They're much more at risk to. At risk for chronic diseases. We talked about that. Without a history, we have no idea what their medical history is. They're at risk for diabetes, or at risk for hypertension. Migrants are especially at risk for poor dental health. Remember, these guys don't have health insurance. These kids don't have health insurance. They're not getting proper dental checkups, nor the adults. So you may find dental issues. Maybe infections in the mouth, gum infections. Dental issues are a big problem with migrants. Malnutrition with these kids. Maybe they're not getting appropriate nutritional resources. Remember, they're here as maybe as a family from another country with very, very limited resources. Disruption of school, we talked about that. Migrant Health Act. There's something called the Migrant Health Act. It provides services, supplemental services for migrant families or migrant individuals. They're outreach clinics. Okay, these are federally funded clinics that once they come into the US and work as migrants, they are entitled to have access to. And the numbers I have are there are 154 migrant centers in 42 states. And they serve over 3 million migrants, but we have way more migrants than that. So it serves a portion of them, small percentage. We talked about farm workers having health risks of pesticide exposure, heat sun exposure, hazardous tools and machinery, very at risk for accidents. If they properly don't know how to work machines, vehicles, tools, very at risk for injuries. Very at risk for, let's say, neuromuscular issues, lifting, bending. Respiratory illnesses from pesticide exposures, skin disorders from pesticide exposures. The other thing that's very prevalent with the migrant farm workers is mental health issues. Your depression, anxiety, be able to take care of your families. Okay. Also a high rate of Parkinson's with migrant farm workers with regards to chemical exposure. The one thing I want you to understand is the difference between, since we keep talking about pesticide exposure, it's the biggest risk for this population. You need to understand the difference between acute and chronic pesticide exposure. Okay, you're going to be asked about this on the exam. So I need you to understand this. I'm just making sure we covered this. Health concerns, I'll get to acute and chronic in a minute. Heat related, pesticide exposure, urinary tract infections is another common health concern. Animals, bites from animals, insects, rodents, snakes. All right, we talked about higher susceptibility to infectious disease. And then we just got finished talking about mental health issues for a variety of reasons. Another mental health issue or anxiety or depression could be that migrant workers have a much higher risk of living in poverty. Right? And think about it, they're always moving around. Just think about the stress levels of all the issues they have going on. And we don't typically think about this on a daily basis. But as a community nurse working in the rural community, and you have farming communities, you are going to be working with the migrant population. We talked about this at the beginning. What are some of the barriers that prevent rural migrant farm workers from receiving health care? They most likely don't have insurance. And if they, let's say they're not in one of these areas that has one of those clinics, migrant outreach clinic, they may not be able to afford going to the urgent care in the community. And we know migrants are in the rural, work in the rural populations that very much have a shortage of healthcare services. They have one doctor working or one nurse working for a whole community. Language barrier. We talked about this, information about what's available to them. Is there health care available to them that they can purchase? How do they understand it? Inability to get sick leave, concern of losing paid work time. Think about it. These aren't jobs. The farm workers don't have jobs that have health and dental and vision and 401k and retirement. Okay, this isn't one of those jobs. Okay, so they are typically paid on an hourly basis or daily rate. So if they get sick or their kid gets sick, they're less likely to go seek care, right? They're not going to get paid for that day, which is another reason they may delay seeking care. And when they finally do, whether it's for their kid or them, they may be at an advanced stage of what they have. You know, for a kid, it could be simply an ear infection. Or let's say they develop a cough or a respiratory issue and it's not dealt with because dad can't afford to take a day off of work. By the time a week later or whatever, they end up in an urgent care. Maybe the kid has pneumonia. Okay. Another issue for migrants is social isolation. Okay. Out in a farm 12 hours a day. And then the other issue, undocumented. Okay. For undocumented workers, if they show up somewhere for healthcare, they worry that something's going to happen to them. Right? Even at these clinics, how will they worry, how will my immigration status affect whether I'm eligible to even show up at one of these clinics? Okay. So what I was going to say is, let's take notes here. Pesticide exposure, acute versus chronic. Some signs of acute pesticide exposure. Memory loss, difficulty concentrating, mood changes, abdominal pain, maybe some nausea, vomiting, diarrhea, skin rashes, eye irritation, throat irritation. That was in one of the quiz questions. Okay. Chronic. Yeah.
Question. So would you say that acute would be something that's like a short term?
Yeah, that's what acute means.
It's more so long term, because I see the effects are different, and it's like more so cancer, blood disorders for chronic, where there's something like lifelong.
Yeah.
And the symptoms for acute are more short term.
Exactly. So that's what we're getting to. Acute is short term. Acute is the here and the now, right? Chronic means you have been exposed to pesticides for a long period of time. What's a long period of time? I don't know. Year, 5 years, 10 years, chronic. There's no real time definition, but it's chronic. You have been chronically exposed. This isn't your first rodeo at a farm. You've been chronically exposed. So think about chronic, long-term exposure, birth defects, cancers, blood disorders, neuro problems. We talked about Parkinson's-like symptoms. Maybe infertility, sterility, long-term. Okay, so over the course of time, the longer you're exposed to pesticides, you know, they show, you know, those commercials you see for asbestos, long-term asbestos exposure, right? Long-term cancer related. Okay. Rural populations, let's see what we didn't cover. I know we talked about access. Okay, so this is for everybody. So ideally, we all should have access to ideally, we should have access to primary care, dental care, mental health, which is also behavioral health, emergency care, public health services, right? So healthy people says that all of us should have access to overall physical, social, mental health status, disease prevention, detection, diagnosis, treatment of illnesses. We all should have quality of life. We all should be able to avoid preventable deaths. We all should be able to have the expected life expectancy. Okay? But that's not how it is for rural people. Okay? We covered a lot of this already, but rural residents often encounter lots of barriers to healthcare that limit their ability to obtain all of this. Okay? They may not have the financial means to pay for services. They may not have the means to reach out to use the services like the private car or the transportation. And since they're in a rural community, they may need to travel distances to get the care they need. They can't take the time off. They won't get paid. Confidence in their ability to communicate, right? Maybe there's that language barrier. Or maybe the comprehension. Maybe they understand a little bit of the language, but they really can't comprehend what the healthcare provider is telling them. They have what the treatment plan is, what the follow-up is. They're not accustomed to knowing the people in the community, so there's a trust issue. Right? They don't want their business out. They don't want their immigration status out to everybody in the community, so there becomes a trust issue. Thinking that people you go to talk about whatever, your health care, and then you have to fill out forms about your history, your immigration status, that's going to expose their privacy. Okay, so we talked about the barriers. One of the big barriers is the lack of workforce. It is really hard to recruit healthcare people in the rural community. And that's what I believe. Oops. Sorry. What did I just get to? Is this? Yeah, look at all these graphs. Look at all the shortages. Okay, if you look at shortages in primary care, then there's shortages in mental health care. Look at all these shortages. It's really hard to recruit in the rural areas for a variety of reasons. We talked about barriers. We talked about distance and transportation. We talked about workforce shortages. Whoops. We didn't talk about internet or health insurance coverage. We talked about that. Very limited health insurance coverage. We didn't talk about broadband yet, but think about it. Those could be issues with internet access. Or health literacy, we talked about that. Social stigma and privacy issues. And the social stigma that comes along with living in a rural population. I mean, we've all heard it. You know, the people that live in rural populations are less educated. We've all heard how sometimes the general population views people that live in the rural areas, right? Does anybody live in a rural area? I do. Right now, I spend half my time in Colorado and half my time way up here. I'm way up here in Northwest Wisconsin. I'm super rural right now. I have nothing around me. Nothing. I think I finally figured out my internet. Finally. Have we had issues with internet today? Oof.
Not today.
I've had to do a lot of problem solving. And what it turned out to be was, I thought it would turn out to be the what am I thinking? Turned out to be internet. which we kind of knew, but a whole bunch of people are added to the account, not on my account, but in the area. And so finally, anyway, long story short, I'm in the middle of nowhere right now. Okay, this closest town for me is a half an hour away. So I've been living in the rural community 6 months, at least 6 months a year, 8 months a year for the last 3 years. I can tell you everything I'm teaching you about the rural community is spot on. And if you've never lived in the rural community or know people or have relatives that live near farms, I'm surrounded by farms, surrounded by agriculture. Every single thing I'm teaching you is dead on true about the rural population. And I remember a couple of years ago during COVID when I was traveling overseas to visit my daughter and I needed a COVID test to go. I'm thinking, oh, I'll just drive into town and get a COVID test. I had to drive 60 miles into the next major town in Eau Claire, 70 miles to get a COVID test. The public health departments up here are little one-house school buildings that are hard, that the public health nurse in my community, because I've already talked, she knows me, she covers 4 counties. So I'm just letting you know that I'm living it. These things happen. Primary access for rural residents. We talked about that. So what's challenging in rural health? Trying to get home health services. Right? That means people have to drive up to my area from either come down from Duluth or go up from Eau Claire. Okay, so the chances, the reimbursement, the insurance coverage for those kinds of driving 80 miles to do a visit may be pretty limited. Right? That's why there's been such an increase in broadband access in the rural communities so that we can do telehealth. Right? Workforce. It's hard to find workforces that will come up to the rural community. It's hard to find hospice and palliative care in the rural community. Right? People driving all these distances to come up and care for a hospice patient. The hospice patient may need to go down to a bigger city to be in a hospice care facility. Mental health services are huge issues in the rural community. Substance abuse, alcoholism, drug use. I mean, I drive down the highway to go to the nearest town and there's 4, if not a few more, billboards within 20 miles that talk about fentanyl. Avoid fentanyl. Mental health services, rehab, addiction services. That's what the billboards say up here. Large drug issue, overdose issue, mental health issue, lots of comorbidities with mental health. Suicide is increased in the rural areas. But look at the shortage of mental health in rural areas. That's a lot of purple. There's not a lot of resources for people with those issues up here or in rural settings in general. We talked about substance abuse disorders, OB. Let's say you have a high-risk OB. You have a high-risk pregnancy. There's not high-risk OBs up here. You got to travel 80 miles to Duluth, 80 miles the other way to Eau Claire. There's no high-risk OB up here. Oral services issue, we talked about that. People don't have dental insurance. Oral issue or dental issues, adults, children. Okay. So you can read through what are some strategies to improve. There's lots of work being done in the rural community. There's lots of government grants And I only know this because I know the public health nurse now up here, having lived up here for several years. And there's lots of government grants. There's lots of things that are being worked on in the rural community to deal with internet access, to deal with healthcare access, to help the migrants when they get here. Lots of things being done. So it's really positive stuff. Okay. Homeless. Okay, we all have homeless populations in our communities. Is there anybody who doesn't? Homelessness has imploded in every community for many different reasons. I particularly saw a huge increase in homelessness, whether it be in Colorado, or I'll talk about Colorado, after COVID, during and after COVID, right? I saw a lot of families in the schools become homeless or have to move in with a family member because somebody lost their job due to COVID, or families going from not being in the poverty, living in poverty, to living in poverty. Okay. There's a lot of reasons people are homeless. Okay. One of the first things, if you are in a role that's working with the homeless population, the very first thing, is you got to check your own feelings. And you're going to hear me say this throughout the term with vulnerable populations. You've got to check your own values, beliefs, stereotypes, prejudices, biases for any population that you care for. And so I introduced that thinking because homelessness is the first real vulnerable population we're talking about. I mean, rural populations migrate, yes, but homelessness, it is important to establish trust. How are you going to, let's assume you've been assigned a clinical for mental health and you're going to go work in a homeless shelter. How do you think these homeless people are going to, how are you going to warm up to them? How are you going to talk to them? How are you going to have them open up to them? Every homeless person has a story, or homeless family has a story. They want to share it. Okay, but this is where trust and therapeutic communication comes into play. And I know you've heard those terms before. What are the risks of the homeless? Just throw them out there. What are they? What additional risks do homeless people have?
Prone to infections,
Mhm.
Pardon me?
drug addictions, drugs,
Use.
Substance abuse,
Mental
most common substance, alcohol abuse, mental health issues. They go hand in hand with it is common, not everybody, but it is common. Substance, alcohol abuse, mental health issues, comorbidities. Living in poverty. Less access to, probably don't have health insurance. Less access to healthcare providers. This is also a population that doesn't seek out primary care. They're not real concerned about primary care, prevention, right? Not their priority. Their priority is surviving day after day, right? They're not into getting to their blood pressure screening visit. Okay? Typically, well, from your reading, where's the most common place homeless people seek healthcare? They go to the neighborhood clinic.
Emergency room.
Emergency rooms. Why is that? Because they don't really have access or know about resources. A lot of them don't know about the resources. Maybe there's a free clinic around them. They don't know about it. They have very limited knowledge about the resources. They're, like I said, they're trying to survive. They go to the emergency room. What's the biggest issue with that? Well, I'm glad they go and get the care they need, but what is an issue with seeking care in the emergency room? Let's talk cost. I'll give you a hint. Let's talk cost.
Not being able to
The
pay.
cost for the, they cannot pay the doctors, like,
Right? That's true. The answer is the reason why it is so expensive to take care of anybody in the emergency room without insurance. It's extremely costly. But that's where homeless seek out their care. Okay, we consider homeless people, homeless individuals without permanent housing who may live on the streets. They may stay in a shelter, mission, single room, maybe they're staying with a relative. Families that don't have a permanent residence to go to are considered homeless. So if you're living with your relative and don't have a permanent residence to go to, you're considered homeless. We talked about risk factors, chronic illnesses, substance abuse, mental illnesses. Homelessness has a negative impact on kids. And different ways to handle, let's say you're working with a homeless family. They may have a baby, a 2-year-old, a 10-year-old, and an 18-year-old. All these kids react differently to being homeless, and their needs are very age specific, right? Initial approach that this is all about trust, therapeutic relationship. This is about common medical conditions. We talked about some of these: cardiovascular disease, mental health and substance abuse, TBIs. Injury and violence is very common amongst the homeless population. Infectious diseases, STDs, communicable diseases, very popular. Skin and foot problems due to exposure, right? Due to heat, cold exposure. Okay. I would like to spend the last few minutes breaking out into a couple of groups or 3 groups and doing this case study. It's about the migrants. We'll just break out into a group for a few minutes and then we'll come back and I want to get your answers. I want to put the knowledge into practice with a case study. Okay, so if you're on your computer, somebody in your group has got to pull up the case study. Okay, I'm going to start assigning you to groups, join, get in your group, and we'll just do it for a few minutes and then we'll come back. Okay? Okay, where are my breakout rooms? There we are. So if you're in room 1, answer question 1. If you're in room 2, answer question 2. Room 3, answer question 3. All right, I'll see you. I'll jump into your rooms, but answer only answer one question. Lorinda, did you get into your group?
I'm in group 4, right?
No, I don't have a group 4.
What group?
You should have an invitation. Let's see. Chandra, you're in room 1. It says you haven't joined yet. You should have an invitation. You need to accept it.
I'm at 1.
And I'm sorry, group 1. Yep.
Okay.
Yep. And then Clarinda, you are in room 2. It looks like you haven't joined yet. Everybody else in your group has.
I thought it was saying close relationship within the house.
No.
Doing okay?
Yes, ma'am.
We're coming
Yes.
back in probably 1 minute.
Okay.
How you guys coming?
I just found the case study, so I'm reading
Oh,
the
okay.
question.
Okay, everybody should have the case study pulled up on their computer. Everybody. So you need to read. Yeah, I was going to bring us all back into the main room, but I'll give you a few more minutes. Okay, so everybody should have it pulled up.
D and E,
Okay.
and it's because he worked in the grape fields for 12 to 13 hours, so that means he will be exposed to sun often. He's responsible.
How'd you do? Could you apply the content that you learned to the case study?
Yes.
That's the goal, right? Well, everybody's coming back in, but that's the goal, is applying knowledge to practice, right? That's what your exam questions are about. That's what your HESI's about. Applying knowledge to practice. All right. I'm going to pull up the case study here. I know people are coming back in. Oh, I didn't use my PowerPoint today. Oh. See, there's just too many things I want to do with you guys. Here's the PowerPoint. Let's make sure we covered everything. I think we did. Our concepts. Are the PowerPoints helpful to you?
Mhm.
Concepts. We talked about our migrant farm workers. We covered all that. Our rural populations. Covered all that. Homelessness. common risk factors, who's affected, we covered that. Some common injuries or illnesses, we covered that. Poverty, definition of poverty, we talked about that. We looked at some of those graphs of, no, we didn't look at those. They're in your readings. They're in your Canvas reading on poverty. Health issues common to poverty, we talked about that. Effects on poverty of young kids, adolescent teens. What can we do to care for these populations? So yeah, we covered. I'm sorry I didn't bring that up. I had every intention of bringing that up. Shame on me. Okay, you do have your notes pages though, you've been taking notes on, right? Okay, all right, let's do case
Professor-
study. Oh, go ahead.
I'm sorry. What graphs? You mean the graphs that's on the,
They're in your readings. They're on
the
your,
like these, some of these?
yep, yes.
Okay.
You don't have to memorize any graphs. It was just giving you a visual. Okay. So now we're working in, I'm not going to reread it, the case study, but as a public health nurse in group 1, you're in a rural practice. What are some professional challenges? And I know these have the answers, but what's some professional challenges in the rural community that the nurse is going to encounter? Did you
so-
come up with C? I guess that's my question. Group 1,
Yes.
did you come up with C?
Yes.
That was your answer? Okay. Right? We know we've talked about rural challenges in the rural practice, professional isolation. You may be the only one there. Right?
Mhm.
Limited opportunities for CEUs. You're not close to conferences or in services that you can go to. Right? You're out there on your own. Okay, heavy workloads. All right. We didn't really talk about this, but think about the rural community. You have to have all your tools. Right? You might be taking care of babies, kids, adolescents, adults, elderly. So you have to be able to function in different clinical areas,
Mm-hmm.
right? Okay, the next group 2, you're working with Mexican immigrants, right? What are you expected to encounter working with the Mexican immigrants? Did you come up with D?
Language barrier, language barrier.
Yeah.
I don't know, I'm just saying, I didn't.
The
they don't
correct
understand.
answer is D. Is that what you guys talking about? Language barriers, understanding information, right?
Yeah.
Okay, typically nurses are considered authority figures.
Why? That's not the garbage right there. Put it outside.
Charmaine, I'm going to mute you. The nurse is considered an authority figure that should respect the individual. We have to be able to relate to all different cultures, irregardless of what community we're in, rural, urban, right? We know that Mexican individuals prefer polite, non-confrontational relationships. Okay, there's a language barrier. It's common to have a language barrier with Mexican clients. Maybe they do this. And we perceive it for, oh, they understand. They get it. They get it. No, that might not be the case. Maybe their family with them in the room. Do you guys understand the discharge instructions we just went through? Everybody nods. How do we really know they understand it? All right. So this rationale, when I send the recording for this class, I will also send this extended version of the case study so you have correct answers and rationale so you can review it more in detail. Okay? Group 3. Right? So Jose is working in the field 12 hours a day. Right? What primary health concerns are we gonna Jose is going to be exposed to? Did you guys come up with C, D, and E?
Yes, ma'am.
You did. Great. Awesome. right? He's gonna, possible musculoskeletal issues, maybe chemical exposures. If it's chronic exposure, maybe skin cancers. All right, so here's a really good rationale about that. About why those three answers are correct. So I don't want to, I'm not going to go through that with you. You can read it on your own, but I will send you my version, my teaching version of the case study so you can review it. Okay? But again, the purpose of the case study is trying case studies is, and we do 3 case studies throughout the term, is to try and put knowledge to practice. Okay? So we covered a lot today. I apologize, I'm late again. I know we should have ended 10 minutes early. I know this class is supposed to go till 10 to the hour because of the extended, because of Memorial Day, so I apologize. Did you learn a lot today about migrants, rural, homeless, poverty? Did you get a lot of good information? If you missed some of the class, go back and review the recording. Okay? And we covered all the housekeeping items at the beginning of class. So I don't want to waste anybody, not waste, but I don't want to keep you any further. Does anybody have any questions that will benefit the whole group? I asked several of you to stay on after. I'll deal with that. But does anybody have any big questions that will benefit the group? If not, you are free to go. And I hope you have a good rest of the week.
You too.
Okay?
Bye-bye.
I'm
Bye.
staying because I have a question.
Okay, that's fine. I know I asked Pretoria, Amar, Shani, Katura. Rafita, did I ask you to stay or are you staying on because you have a question? Chandra, you're going to log off and come back in 10 minutes.
I'm staying because I have a question. You want me to log off and come back?
No, I want Chandra to log off because I have a scheduled meeting with her. Is this a question, Rafita, that everybody can hear or do you need to be in a breakout room?
I need a breakout room, please.
Okay. All right. I think everybody else, I have the same, I'm going to have, no, Shani. All right. Let me get going into breakout rooms. Hang on. You guys are just going to have to be patient with me. Okay. So move to breakout room 4, Pretoria. Okay. Nope. Pretoria. I'm going to move to 5. Shani's in 3. Who else do I have? Okay. I think I have everybody. So get in your rooms. I'm just going to have to, you're just going to have to be patient with me. Okay. All right. Okay. Okay. What's your question?
I did email you about the group project. I don't know if you.
I think I read it briefly. Is it about not, are you Orange Park?
Yes.
Yeah, I had to, I did the best I could. I think I only have a couple. I have 1, 2, 3, 4, 5, 6, 7. So I had 7 Orange Park students. So I had enough for 4 and 3. I did my best. Do you have any orange?
For the, I think the second group, Vanessa, I don't really remember her full name, but I think Vanessa, she's not an Orange Park, is she?
You know what? I can't. It's okay to work with other students as well. Okay.
How?
I don't know if you're checking. Let's see, Vanessa. No, she's not Orange Park.
Yeah, that's why I'm trying to, I mean, if you can switch me with her.
Yeah, I'm
I know
not sure.
She's not
Well,
Orange Park.
Right. I'll see what I can do. But, typically professors don't put students in the same campuses in the same group. They want them out there meeting all different groups of people. So as much as I try to do that, I can have a look at it, but I can't guarantee you anything.
Yeah, I did email you about it. It's because
I know you did
said that before. You say you're gonna try to put
Try.
all the students together.
Yeah,
That's
tried.
why I emailed
Okay.
you.
I'll take a look at it, but for right now, participate in the group that you're assigned to.
So yeah, how can I reach out to them? Because I don't have
You
their
have
phone.
all, you have all their emails. In your student Ross, in your student shell, all their emails are in there.
Hmm.
Yep. Yep, I already have a couple of groups. Somebody took the lead and sent out group meetings to everybody, or group email to everybody. So it can be done. You have all their emails.
Okay.
Okay?
Yeah, I'll try.
Okay. All right. But stick
Okay,
with what you have right now. I'm not sure if I can change it, but stick with what you have.
Okay.
Okay.
All right. Thank you.
Yep. Shawnee, we had a meeting scheduled last week.
Yeah, I didn't know how to do that. Like was I supposed to get on the Zoom?
Yeah. It
Oh,
says
okay.
it,
I didn't know if you would like.
yeah, no, it says in one of your announcements, if for any of the meetings we have during the term, it's on Zoom.
Okay, yeah, I didn't know if because I was in a car that
Oh,
because
we
I had
couldn't-
to
yeah, we
yeah,
couldn't
I
have
had
met
to
anyway.
drop my
That's-
uncle off at the ER,
Okay.
and it was just I'm sorry, it
That's
was
okay, but
very
you had
stressful.
requested to meet and we set up a
Yeah.
meeting, so I didn't
It
hear
was
from,
Yeah, I just wanted a quick little thing just to like ask for advice on like.
well, let's reschedule then, okay? So
Okay, yeah.
why don't you send me some days and times this week, but it's hard when it's a no call, no show, right?
Yeah, I'm sorry.
That's okay.
It
It's
was
okay.
a really stressful weekend.
I'm sorry. Is your relative better?
Yeah, he had really bad strep throat, and then they just don't know what he's got, and they just
Yeah.
And it sucks that nobody else can really do it, so it was just put on me. So that's yeah.
Yeah.
But it's fine now.